All right, so I'm a licensed naturopathic doctor. I went to school at Bastyr University, California, which is a 4-year postdoctorate naturopathic education. My clinical practice is in Shorewood. I practice at Lakeside Natural Medicine, and my practices focuses on chronic conditions such as chronic fatigue, autoimmune disorders, hormone balancing, gut health, etc. Okay, so raise your hand if you feel like the nutrition narrative is confusing to you. All right, so I'm sure all of you are nodding your head, yes. So it's confusing, right? There's so many different diets out there, gluten-free, vegan, keto, paleo. It's confusing. And my hope today is to bring some clarity to that confusion for you all and take your health into your own hands by starting in the kitchen. Okay, so number one, it sounds so simple, but we have to ask ourselves, what is real whole food, right? Food is more than just calories. It's more than just fuel. It's information for our cells. Food has the ability to affect our genes, modulate our hormones, ladies, increase or decrease inflammation, and lastly, affect your microbiome or your gut health. Food really is medicine. So let's ask ourselves, does this food have a mother? So when we're looking at the food, is it a chicken, egg? Yes, that food has a mother, real food, right? Did this food grow in the ground, right? Plants, real food. Did this food have more than 5 ingredients on the label? A little bit more processed food, not as much real whole food. Was this food made into a factory? All right, yeah, that's definitely processed food. So what exactly is the difference between an Atkins bar and an avocado? Let's just take a look at some of these ingredients. Chocolate flavored coating. What is that, right? We can't even pronounce probably half of these things on here. Yeah, sure, it has 17 grams of protein, low carb, but is this really going to help you lose weight in the long run? Probably not. Avocado, one ingredient, real whole food. It's that simple. So a good rule of thumb is that you can't pronounce it, put it down. If you can recognize all the ingredients, then it's okay. So processed foods in general are high in sugar and high fructose corn syrup. This is going to increase an insulin response in your body, which is an anabolic hormone that's going to help to store more fat. So we're going to help to reduce that by limiting these types of foods. Processed foods are also engineered for overconsumption. Food manufacturers spend thousands amount of resources manufacturing these foods so that they're hyper palatable and that you overconsume, so that you eat. Number 3, they contain artificial ingredients such as preservatives, food dyes, flavor enhancers, and texturants. We know that food dyes are neurotoxins. They cause hyperactivity in children. So especially for your children, if you ever see red dye number 40, put that down, especially for your kids. Processed foods are also high in refined carbohydrates, which we know spike your blood sugar and insulin. So don't be fooled by the 100% whole grain Cheerios. They're mashed beyond an oat looks like, right? If you compare a bag of oats to a Cheerio, they are beyond recognition. They have more than 5 ingredients. So in general, we want to stay away from those types of foods and focus on just oats, a real whole food, a single ingredient. And then processed foods are generally devoid of nutrients. So the more that we eat these processed foods, the less nutrients they're going to have in them. I see this a lot with zinc, B12, and iron. And then they're low in fiber, which isn't going to help your gut in any way. And they're addictive. So what do we want to eat more of? What do we want to focus our diet more on? Plants. That's one thing that nutritionists, doctors, scientists can all agree on, that we need to be eating more plants. And I like to give myself goals, especially for my patients, to keep it really, really simple. So we're going to start by eating 2 cups of leafy greens, green leafy greens, once a day. Kale, spinach, arugula, collard greens. This is good in a salad or in a smoothie. These are going to give you a good source of folate, which is going to help detox and also give you a good amount of bulk for your stool. 2 cups of cruciferous vegetables. Cruciferous vegetables are a superfood for hormones, ladies. They help you detox estrogen out of the body. They're so yummy roasted in the oven. This is something you can do every day with your salad or with your dinner. And then 2 cups of color. I'm going to get into that more on the next slide, but they're rich in those antioxidants. We know vegetables are healthy, but they're also rich in antioxidants, which give it that extra kick. And then we want to try to limit fruit, especially if you're watching your weight or your blood sugar, because fruit is generally higher in sugar. But if you are going to have some fruit, then berries are best because they're low in sugar and they're high in those antioxidants we're going to talk about. So 2 servings a day. Okay, so like I said, antioxidants are compounds that quell free radicals. So they literally put out fires in your body. Most foods can increase, most processed foods, like we talked about, can increase pro-oxidative state in your body. So it increases more rust, if you will. So it increases your cancer risk, there's more inflammation. So to combat that, we eat more antioxidants in our diet. So simply put, antioxidants are color. So rest assured, if there's lots of color on your plate, then you got your antioxidants. So purple contains the antioxidant called anthocyanin, and it accumulates in the hippocampus and helps to improve memory, improve anti-aging, and it decreases your cancer risk. So beets, eggplants, purple cabbage, purple sweet potatoes. Forbidden rice is a nice one, a nice grain version. Red, lycopene. So this is great for men's health more so. It's more bioavailable if you cook the vegetables such as tomatoes, but it also keeps your heart healthy as well. And then orange and yellow, which is rich in that beta carotene, which is vitamin A, a plant source of vitamin A, and that's going to help with your immune system. We all know that when it comes fall, the orange colors, they come with it. So sometimes eating with the seasons can really help us with our diets. But that's going to be your squash, yellow peppers, carrots, sweet potatoes, pumpkin. Okay, fat. Let's talk about fat. So no longer do we believe that fat is all evil. Really, sugar is more so the culprit. Research shows that when we decrease our fat consumption, we actually increase our carbs. So fat is your friend. Fat is used to make hormones, cushion your body's tissues, and store energy. And essential fats, we don't get them anywhere else but our diet. So we have to really be conscious of these essential fats, or these omega-3s and 6s. Omega-3s are known to be more anti-inflammatory versus omega-6s are more inflammatory. The American diet is much higher in the omega-6s. So here I'm listing the omega-3s that I want you to really emphasize in your diet. So salmon, sardines, walnuts, flax seeds. We're going to get into some of these a little bit later, but they're anti-inflammatory, they help with hormones, they increase BDNF, which is brain-derived neurotrophic factor, which is actually like miracle for your brain. But it's a protein that helps to protect the brain. It's great for your heart health as well. Okay, so cooking fats. We also want to cook with some fats. Olive oil is a great option. It's a monounsaturated fatty acid. So it's a little bit more stable than those other fats, the PUFAs that we just talked about, those omega-3s and 6s. This is a good one to cook with because it has a oleocanthal in it. It's a compound that's anti-inflammatory and removes that sticky plaque in Alzheimer's disease, the amyloid plaque. It also is a naturally occurring NSAID. Research has shown that it's similar to ibuprofen. So get in your olive oil. You know you have a good quality oil. If you can have that peppery taste in the back of your throat, that's when you know you have a good quality. Trader Joe's has one. And then if you want to look for the stamp of approval, the North American Olive Oil Association also helps you kind of pick out which oils is best. But notice here how the bottle is in a glass bottle and it's darkened, right? So we have to protect our oils from the sun, from going rancid quickly. And then glass helps protect any fat-soluble ingredients and plastics from getting into your oils. Okay, so avocado oil, we kind of just talked about olive oil. Olive oil is more of a dressing and 375 and below. So you don't want to cook high heat with olive oil. Avocado oil, though, is actually the one that you want to do 375 and above. So great for roasting veggies in the oven, rich in vitamin E, it's anti-aging, and it has a high smoke point. Coconut oil, sometimes that's good if you need a little bit of more boost, more saturated fat, that's a little bit better choice. maybe than something else. But it's a medium chain triglyceride, which helps with energy production, and put it in your water if you're hungry between meals to help promote leptin sensitization, which is a hormone in your fat cells. It tells your body that it's hungry, keep eating, or it's full and stops you from eating. They also contains lauric acid, which is antiviral, and it also helps to promote your immune system. So if you have lots of brain fog, you're probably eating too many carbs and you need a little bit more fat or protein. And then saturated fat, it gets bad raps, but it's good for the highest temperature that you're cooking with, because it's the most stable fat that you can. So coconut oil and butter are probably the most stable fats with really high temperatures. But replacing these fats with those olive oil and the other oils I've talked about is a good idea. So when you are buying these, you want to make sure it's grass-fed for good quality oils. The grass-fed cows actually have a similar omega profile to a salmon. So eating corn-fed meat actually will reduce the omega content in your butter and the meat as well. We all kind of know this. We want to avoid those highly processed vegetable oils, but canola oil is always like marketed for being good for heart health, right? But it's highly refined. It's high in inflammatory fats, and people who cook with more canola oil actually are more likely to have metabolic syndrome, which is diabetes, heart disease, high blood pressure, excess belly fat. So try to avoid those as much as you can, unless it's raw, unrefined canola oil, and they have a little bit different story. And then trans fats, we kind of know these are bad fats as well. They're inflammatory. So things like Smart Balance, even in those, you're better off getting real butter, real grass-fed butter. All right, so protein. So many women are not getting in enough protein. This is every day in my practice. Protein, a diet with about 30% protein, was found to help women lose on average of 11 pounds in 12 weeks. So protein can help us lose weight because it keeps us feeling full, and we can feel really full on protein. So here are some clean sources of protein that you can try. So we talked about the salmon, the organic chicken, turkey, grass-fed meat. Bone broth is great for soups if you want to feel a little bit more full. And then quinoa is another great grain that's a little bit higher in protein. And then if you're a vegan or vegetarian, try to do organic tofu and tempeh as much as you can, because it is a highly genetically modified food.
Can I ask a quick question about the salmon?
Yeah.
Are you supposed to just totally avoid the farm-raised salmon, or is some of that okay?
I would say if you want to be a purist, then try to get wild caught as much as you can, just for the different plastic residues that could be in the other type of farm fish. But if you're trying to save money here and there, you know, moderation's okay, but I would say for the most time, wild caught's probably best. Okay, so nuts and seeds, these are great for snacking. They're high in protein and fat. Walnuts, they look like a brain. They're good for your brain, right? Brazil nuts, they're rich in selenium, which is basically food for your thyroid. So 3 to 5 Brazil nuts a day can help boost that thyroid gland and the cofactors it needs to metabolize everything. Flax seeds are a superfood for hormones. They contain lignans, which have a phytoestrogen effect. So what that basically means is if you have too low of estrogen or too high of estrogen, flax seeds helps to balance out that balance. So menopause women, women before menopause can all benefit from flax seeds. You can add them to baked goods, oatmeal, and smoothies. And then some proteins that we want to try to limit or avoid are the corn-fed meat, conventional meat that have antibiotics and hormones pumping through them, smoking black or charred meat, processed meats. So processed meats are actually considered a category 1 carcinogen, which means that they are literally known to cause cancer, similar to tobacco smoking and asbestos. So the type of meat you're eating is important. All right. Yeah.
Like the sausage, even the stuff that you might see at Trader Joe's or wherever that says no nitrates or no, you know.
That's a little different. So it might be a chicken sausage.
Chicken sausage,
so that's usually okay.
Okay.
Yeah, so that's a little different. It's more so like the patties you'll see. Yeah, the typical stuff you'll see.
Yeah. And what about sardines in a can?
Is-
Smoked sardine, well, I suppose smoked maybe not.
Yeah, that's-
Flavoring.
That
That's
should be
good.
fine usually.
On a, maybe weekly basis.
No, yeah, actually sardines are great if you like
You
sardines.
can't get them any other way, right, just in cans?
I'm pretty sure, yeah, it's the only way. Unless like there's a fresh fish market, I'm not sure, but that's usually how you get them. And if you could eat those a lot, like every day, that'd be great for you.
And lastly, what about eggs? I haven't always bought something organic, but I often wonder, I don't know what the eggs, the regular eggs that you buy if you're using eggs.
So I learned recently you can check the quality of your eggs by how they land on the pan. So if your eggs are kind of sliding all around the pan, then it's probably not as fresh of an egg. So if you crack the egg and it sticks right on the pan, it doesn't move, you know you got a good quality of fresh egg. So like a farmer's egg, you should try it with friends if you know like a farmer that has eggs and see what happens. And I know there's not another way to check the label, but typically if you can get, you know, the pasture raised eggs, that's the best way. Just a good healthy life for the chicken, you know, means good healthy eggs for you.
I just didn't know what they were fed, like if they're fed all, you know, soy or corn or whatever. I mean, if we have to be concerned about. and
It's
maybe-
very similar with, yeah, it's all related. So the pasture raised eggs, yeah, right. Okay, so this is where it gets individualized. So not everyone's going to be the same. And that's where that gluten-free may mean something for you and nothing for the other person. But these are the top 2 food sensitivities that I see in my practice every single day. So gluten and dairy. So what is a food sensitivity? It's similar to an anaphylactic reaction, but it's less severe and it's less immediate. It's over hours to days after the exposure. And you might have GI symptoms like pain, diarrhea, gas, bloating, or skin rashes like eczema. You might have more fatigue, brain fog, headaches, congestion, maybe some arthritis as well. And these can be triggered by different foods that you are eating. And if you are a little unsure, then you can run this food sensitivity test. That's what I do a lot in my practice. And we can see, you know, objectively what foods are actually causing an immune response for you. Okay, nutrition essential number 6, avoid sugar. So we know the damage caused by sugar is linked to cancer, obesity, heart disease, diabetes, stroke, and depression. We have to stop. We have to put the sugar down, look at some nutrition labels, and you might start to see a trend that most of them have added sugars in them, from our condiments to the packaged foods, etc. So limiting that added sugar, nourishing dark chocolate can taste so sweet when you cut out sugar. Dates, smoothies, berries, and then there's also some sugar substitutes you can do. But just start looking at the labels and just start becoming aware of, you know, what are you eating. And then number 7, I recommend everyone to start eating more turmeric. So turmeric has so many benefits for you. It's anti-inflammatory, improves your mood, great for your gut health, good for arthritis if you have joints that are hurting. And a good goal is 2 teaspoons a day. You can sprinkle it right on your cruciferous vegetables. It has like an earthy taste, doesn't taste really much like anything. And you can pretty much add it to every meal. If you add it with fat and black pepper, it helps with absorption. And then if you are looking for a supplement, you want to find one that's bound to a phospholipid for optimal absorption. So you don't need that black pepper and fat. So we carry Mariva, and that works really well for our patients. But just adding it into your diet every day can be really effective. And then including more fermented foods is really key for gut health and improving your microbiome. So sauerkraut, kimchi, all of these things, start including into your diet. Sip on miso instead of tea. Think of it more as like a daily meditation practice. You're getting in all your fermented foods, and the best fermented foods are going to be in the the fridge section of the grocery store. So it's going to be a live culture. You might even open it up and it might explode on you because it's live culture, right? So that's to know you got good bacteria in there. You can even make your own at home. It's pretty easy. But it helps managing your weight, your mood, and actually helping reduce vaginal and urinary tract infections. And then drinking green tea is another one that I like to tell people about. It's a superfood for hormones as well. It helps you detox estrogen, and also helps with memory, focus. If you're really jittery on coffee, try green tea. It has L-theanine in it, which is really grounding. So this, along with flax seeds and those cruciferous veggies, are going to be key. All right, so just to wrap it up, it's not just what we're eating, it's when and how we're eating too. Intermittent fasting has been shown to have all these benefits, such as clearing free radicals, reducing insulin response, promoting weight loss, avoiding snacking. And a good prolonged fast is what I usually recommend, around 12 to 16 hours, and then no snacking between meals. But everyone is different, so not everyone is going to feel great on this, but that's, you know, the individualization about this. And then just being mindful that, you know, our diet is really close to that guilt and shame piece if we ever stray from the path, right? It's okay. It's a process. You're not always going to eat 100% good per se. So let's try to change that mindset instead of I want it, but I can't have it, to I don't want it, it's toxic to me. Let's build those relationships between food and our symptoms. That'll help us to stay the course, stay consistent. Pay attention to your hunger cues, chew your food, and then, you know, sit down with meals, right? And then just different labs that I like to recommend to optimize health are micronutrient testing, which we kind of discussed, vitamins and minerals, food sensitivity testing, stool testing, hormone testing. And then we do have a sign up over there at the front for all the recipes and grocery list to get you started on this new healthy kit. You can make sure to contact or follow us on Instagram and Facebook or TikTok. And yeah, and then if you do want to make an appointment with me, just mention my name at Lakeside Natural Medicine. But that's it. Any questions?
I have a question.
Yeah.
So if you drink something like a turmeric tea, do you get enough in that to count for anything?
Of course, yeah.
Okay.
So there's probably like 2 tablespoons or a little bit more of turmeric in there.
Okay.
And if you had maybe 3 cups of that a day, good effect.
Okay.
Yeah.
How often do you recommend people do the intermittent fasting? A couple times a week, or is this daily?
It's a daily practice, so pretty much every day. I don't recommend it for everyone though, but postmenopausal women do really well on it, and it helps to balance their hormones out a little bit better than premenopausal. So like 12 to 16 hours.
I read something recently that they had done studies on the fasting thing, and it didn't really do all the things that people thought it was supposed to do, that there wasn't really all that much benefit to do it to that.
That's where I think it's individualized, like I was saying. It may not work for everyone, but I do have a lot of studies that back up that research. So I would suggest just trying it and see if it feels good for you, but it may not feel great for you. Yeah.
One of the most interesting studies, I know the one that you're referring to that just came out, it looked at breast cancer survivors and those who did a nightly fast of at least 13 hours had higher survival rates than those who had shorter fast times. So that was pretty interesting.
Yeah.
To me.
Yeah.
Would you do fermented foods for lunchtime and dinner time every day, or is it kind of like sporadic?
Yeah, you could have them as much as possible. If you have more gas and bloating after starting it, then maybe go slow. So start building up. Just like fiber, you don't want to just go right into it. You want to build it up.
What was your question?
Fermented foods, is it okay to have it more than once a day, or sorry, one time a day? And of course, yeah. Yeah.
What is your opinion of adding a protein powder to a shake? I just saw my doctor today, and I'm supposed to be increasing my protein. And I don't like a lot of meat, and I'm kind of experimenting with things. But what about shakes like with kale and stuff? But where do you add protein and what happens?
Yeah.
Is it real protein that you're getting when you do that?
So yeah, I like a plant-based protein. Personally, everyone has differences, but like Sun Warrior has a good brand that has a good protein, and I add like 2 handfuls of spinach or kale with a little bit of fruit, like we kind of talked about, and then you just want to make sure it's balanced. Maybe some fat in there as well.
Is this like a yogurt or I guess yogurt?
You could add coconut oil. You could add avocados.
Mhm.
That'll make it nice and creamy. And then you could also add almond milk or some type of different milk in there too. And then the chia seeds or the flax seeds add a nice fat too. So those are, we have a lot of recipes, so if you sign up, you can get a recipe for a smoothie.
Okay,
Yeah,
thank you.
yeah.
Do you see children?
I personally don't see children, but another person at I see like teenagers and above, but another person at our practice does see children. Yeah. Any other questions?
Okay, I have one more.
Yeah.
How do you feel about high oleic sunflower oil?
Sunflower oil.
Not regular sunflower oil, high
High oleic.
oleic.
Huh, I haven't heard of that one.
Okay. And
Um,
it's something you can get local and it's
typically-
supposed to be.
typically if it's
better.
unrefined and it's like a raw oil, that it's probably more as a dressing, I would imagine, than cooking with. I would imagine it's probably more prone to oxidation if you cook with it. But maybe like sesame oil, I know for sure it's good as a dressing more than cooking. But it's probably similar to that.
Right.
Yeah. But if you were gonna stick to any oil, I would say olive oil is your best bet. That's gonna be good for your heart health. There's so many studies on it. That's the one I would choose.
So I was just trying to remember for brain health, a couple things I saw in your slides, the walnuts
Yeah.
daily, the intermittent fasting, and was there anything else
Um,
on there? Or, sorry.
The walnuts, any kind of fat is gonna be good for your brain.
Oh, was it
Avoiding
coconut?
sugar. Let me just see here. I believe those were the two things, and then the anthocyanins, the purple
Oh, right.
anthocyanins.
Okay, great, thank you.
Or over there, sorry.
Can you tell me what forbidden rice is?
Forbidden rice is like something your great grandmother would recognize as a grain, right? So it's purple in color. You can get it at Outpost, and it's just a whole grain that has those purple anthocyanins in it.
Oh, okay.
Yeah.
That was my exact question.
Oh, okay.
Yeah, thank you.
Yeah, that's a good one. And then there was one more that was the quinoa too, but
I have a question. So, if you can't buy like all natural or organic everything all the time,
right, yeah.
what's the biggest bang for your buck? Is it like getting the meat, like the grass?
Yeah, so I'm on the same page as you, right? I don't want to spend $1,000 on groceries. So what I recommend is if you look up the Dirty Dozen by the EWG, Environmental Working Group, and then like the easiest ones are like the berries, you want to buy those organic, peppers, and then most of the other things, if it has a peel like avocado, you can get the traditional. You don't need to spend extra because it's on the outside. That's what I would recommend. Yeah. Yeah. And you pick your battles, right? So maybe some weeks you buy the pasture-raised eggs, or if there's a huge difference, in price, just increasing those foods is key. Yeah. Any other questions? Great. Thank you.
Hi, so my name is Penelope Van Osten. I'm one of the PTs here at Freedom. I've been a clinician for going on 20 years, and I've done orthopedics the entirety of my career. So a lot's changed over the 20 years of doing orthopedics. There's a lot more focus on pelvic floor dysfunction, jaw dysfunction, and really a lot of new research is coming out on what the link between these two dysfunctions are. There's not always a link, but they've been doing some interesting research and really just kind of findings that they've decided to explore more on really how everything is interconnected. So this is going to be a brief introduction to pelvic floor and temporomandibular joint dysfunction and how posture can play a role in that. So just an introduction. This is a nice, always timeless picture of the body. Why would we even consider that the jaw and the pelvis might be connected? I think it was Aristotle that said the whole of the body is greater than the sum of its parts. So that really means that while each of the pieces individually are important, the whole of them together creates something that's even bigger. And that follows very true for the body. So if we try to treat the body just in isolation, we don't really get good results. So if we try to treat the body more as a whole entity, we end up finding that our systems are synergistic, and one triumph in a system really helps another system. So we're going to start with a few definitions first. So we're going to talk about what proper posture is, what the pelvic floor is, and what its dysfunctions, some of its more common dysfunctions are. What defines the temporomandibular joint, and again, what are some of the more common dysfunctions that we see there. So starting with posture, anatomically speaking, proper posture is really a stacked vertical alignment of our skeletal system. So if we think about our head being the top, sits right over our rib cage, sits over our pelvis, sits directly over our knees and our feet. So that's what we're going to talk about as being proper posture. Pelvic floor. Pelvic floor is our pelvic girdle. So we've got our hip bones, and then we've got a whole collection of muscles that sit in the bowl of our pelvic floor. So that's gonna be our anatomical reference for pelvic floor. Associated dysfunctions, there are many. So some of the more common that we see here in the clinic would be any sort of pelvic pain, urinary incontinence, could be bowel incontinence, leaking urine with stressful activities like running, laughing, jumping, even pain or urinary leaking with sex. So any of that can fall under the category of a dysfunction. And really, the way I talk to a patient about it is this disrupting your normal life? If so, yes, then we can consider it a dysfunction. So what defines the temporomandibular joint? That most people know of as our jaw. We've got two hinge points on the jaw that operate our lower jaw that opens and closes, and all the muscles that go along with operating that as well. So that's going to be located in the head and face. Common associated dysfunctions there. People generally think of, well, my jaw clicks, my jaw pops, I have pain when I chew, I have limited opening, I get locking. Again, does it disrupt your normal life? Do you have difficulty speaking, eating, brushing your teeth? So those are going to be the dysfunctions that we're talking about for the jaw. And then this is just a nice graphic here. This is actually from 1939, and it's really still relevant. The posture on the left, you can see that nice, we call this a plumb line, that line that goes directly through the center there. You can see how everything that I talked about is really nicely stacked. So the head's on top of rib cage is on pelvis, pelvis is right over knees and feet. And then this one over here would be one example of poor posture. There are many different postural deviations. This is really the most common. So head is slumped forward, the upper back is rounded, the pelvic girdle is kind of rolled inward and under, knees are bent, and he's not over his heels. And then here is a visual of what we would talk about for our pelvic floor. So that's a visual, this one over here on the left is in the body. And then here, you can see this is the pelvic girdle, we call it here. These two outer bones are the hips. This coming down here is actually the spine, tailbone kind of hooking under the buttocks. And then this joint here is where most people know as the pubic bone. So kind of right where the zipper of our pants is. All right, and then just a visual of the temporomandibular joint. So again, that hinge joint here comes down from the chin. This is the skull here. Two hinge points for our jaw, open and close that. And then you've got some of the associated muscles through the cheek and in through some of the bones of the skull that help operate the jaw. Now, before going any further, I need to introduce a concept called pressure systems. This is kind of a newer concept that has really been looked at. I would say probably more with some good research in the last 5 years. So pressure systems are just what they sound like. It's a closed system within our bodies that have the ability to regulate pressure either by decreasing or increasing it in order to help us function more efficiently. So our body, the pressure systems we're going to talk about here and how these relate to our jaw and pelvic dysfunction. We have 3 main ones. So starting from top down, we've got the oral pharyngeal, the thoracic, and the abdominal. So the oral pharyngeal is going to start, the top portion of that is really going to be the roof of your mouth. So your hard palate. I'm including the tongue in there because the tongue's a pivotal, it's going to be a pivotal muscle. So it starts at the hard palate, roof of the mouth, and it goes to the glottis, which is essentially mid-neck and vocal cords. The thoracic canister is going to be from your mid-neck, your glottis, and it's going to go down to your diaphragm, which is your large respiratory muscle that sits right under the rib cage. You can actually palpate it. You can feel it if you kind of dig up and under those ribs. And then the abdominal cavity or pressure system is going to start, top of it is going to be the diaphragm, and the bottom is going to be all the way down to our pelvic floor. So those muscles that sit at the bottom of our bowl. And then for purposes here, I'm going to talk about a TMJ dysfunction would be an inability to regulate pressure through this oral cavity. And then a pelvic floor dysfunction would be an inability to properly regulate pressure through your pelvic system. I promise I'll bring this all together. And then here is another graphic just giving you an idea of where, again, these cavities lie. So we've got a few more cavities listed on the screen than we need. But the top, the oral pharyngeal, is going to start at the hard palate and go to the mid-throat. The thoracic cavity, mid-throat, and here's that diaphragm right there. So it's kind of just right about the lower breast area. And then the abdominal cavity, which houses our pelvic floor, is going to be from the diaphragm all the way down to where the genitalia sit. All right, so why do we care about these pressure systems? So the pressure regulation that occurs through these systems actually helps provide us with the structural stability for our postural muscles to function properly. In turn, this is going to allow our postural muscles to produce more efficient stability and mobility for us. That means just better movement, more ease of movement, less energy expenditure to do an activity. Our body is always looking to be as efficient as possible. So efficiency means the least amount of energy in to get the greatest amount of energy out. Our bodies are really craving that. That's what they want. So a dysfunction in our ability to regulate our pressures properly through all these systems is going to decrease our stability, our mobility, and ultimately our function. Now for this lecture, our key is if we lose the ability or do not have the ability to close that upper seal in the roof of the mouth, that glottis, that can affect how we generate pressure through the rest of our system and can affect how efficiently we're able to strengthen. And then here, this kind of gives you a nice conceptual idea of, if you think of a closed soda can there on the left, and the tab isn't popped, it's sealed. And if you think of that as the top of our pressure system, which would be our hard palate and our tongue and those vocal cord folds. If that's sealed, that can is very stable. It's very hard to deform. If you pop that seal, it's very easy to crush the can. So if we don't have that ability to seal the top of our own pressure canister, we inherently become less stable. All right, And then just defining a little bit more what that glottal closure means. So the glottis is the opening that separates our vocal cords right in the middle of our throat. So right where we have our voice box, it's around where when you swallow that you feel that, that kind of lump in your throat go up and down. So there are vocal cords that sit in that opening on the way to the trachea and the lungs. And the glottis is the opening that separates the vocal cords. That acts like a valve, and it opens and closes depending on what kind of pitch we're speaking with, how much, if we're yelling, if we're whispering, if we're singing. So that's in constant flux depending on what we need. And closure of that is basically the act of closing that space and closing it off. So then you're sealing that upper canister. How is it done? So it's pretty simple. What you would do is just take the tip of your tongue, rest it on the roof of your mouth. So not pushing against your teeth, the roof of your mouth, meaning you feel those little ridges, called rugae on the hard palate of your mouth. So if you push up there, and then you're going to take your hands, and you can actually, I'll have you put under your chin. And what you're going to do is you're going to notice that when I tell you to push that tongue up into the roof of that mouth, you should feel those muscles down there pop out. So that's your seal. So that's closing off your glottis. And then again, here's a nice visual just to kind of give you an idea about where these vocal cords sit and what they look like. So this would be looking down somebody's throat. This is the windpipe going down into the lungs. These are closed folds. These are open. Okay. So how does posture link pelvic floor dysfunction and temporomandibular dysfunction? So poor posture, not always, but it can change our ability's inherent structural integrity. So when we're not standing and stacked and in this nice, efficient, load-bearing position, what happens is it changes how our structures interact with each other. It puts more stress on them. We tend to get, somebody sits like this over a computer all day. We see it all day long here. They come in with neck pain. They come in with upper back pain. Then they come in with lower back pain. So anytime you take yourself out of that nice vertical alignment, you are going to change the structural integrity of how all of your tissues are working together. That may affect your ability to close your glottis properly. So without that ability to close the glottis, that's going to decrease our ability to efficiently regulate pressures more, like lower in the system, through that thoracic cavity, through that abdominal cavity. And it's gonna, it can lead to producing less efficient core strengthening. So if you think of like a bike tire, it's a lot harder to ride a bike on flat tires because that pressure is not there. That pressure is not there to push against the ground to keep you moving. So it's the same idea here. If we can't regulate that pressure from the top down, we're not going to have the pressure from above giving us that pressure from below that we need to generate enough strengthening through our core or through our pelvic floor. And then bringing it all together, poor posture can give you a possible inability for the glottal closure. It's going to in turn may decrease your ability to adequately increase those pressures lower in the system, which is again going to decrease your ability for more efficient strengthening through your core, your pelvic floor, and then can increase your susceptibility to dysfunction. Now, one thing I really, really want to point out is that this is not an absolute cascade of events. Just because you might have jaw pain or clicking or popping absolutely does not mean that you are going to have or will have or can have pelvic floor dysfunction. They don't always go together, but they started to see a lot of women that were having pelvic floor dysfunction. A lot of it was incontinence, inability to really generate a lot of strengthening and pressure down there. And they were finding that they also were having an inability to really regulate their jaw function. So again, a lot of research in how these systems link together has really come out. I would really say in the last 5 years. So again, it's always evolving. Over 20 years, I've seen a lot of kind of fads come and go, and you know, it'll be interesting to see what more comes of this. But did you have a question? Maybe? Oh no.
I have a question. Regarding the glottal closure, is resting your tongue up there against that ridge, is that the same? It's not the same, is it? You're talking about
not the
pressure.
same. Correct. However, that your tongue should naturally rest in that position up there.
Right, when you're relaxed and
Yes.
through the day.
Yes. So one of the things that, because we treat a lot of jaw dysfunction in this clinic, so one of the first things that we look at, or we ask our patients, as you sit, where do you feel your tongue resting? Is it pushing against your teeth? Is it on the bottom of your jaw? Is it up on the roof of your mouth? Where do you feel it? Naturally, it should go to rest on the roof of your mouth. So that it shouldn't be a big stretch then to give that a little bit of a push into the roof to generate that glottal closure. But some people really don't have either the awareness, or they have, could be a myriad of other issues that has brought them to the point where their tongue no longer rests where it's supposed to. And that's something that we work on. Sometimes it's just as simple as being aware.
But that would happen, that pressure you would be needing like for core strengthening, for exercise. You don't want that core, that glottal pressure all day long.
You don't want it all day
relaxed
long.
in your mouth. 'Cause
Right.
I think of, you know, the joint
Yes, so you're not gonna sit there, yeah, with your tongue,
pressure here.
you know.
Maybe it happens here and there, but not cognitive.
So the way I instruct in the clinic, if I'm seeing somebody that's, you know, that we're working on core, is I'll say whenever you're working on core, or you're doing a functional activity that might be a little bit more difficult for you, where like you leak urine, in addition to the things we're working on in the pelvis, I'll say, do your activity to close the glottis, while you also do, maybe if you're lifting your baby out of the crib, you know, or you're pulling that pan out of the oven or something. Yep. So my last slide was just questions. And it was a lot of information, so hopefully it made sense. Any questions from anybody on any of the anatomy or how it works together? Or? Yes.
So I guess just to follow up to what this woman was saying, I had a question as well. So the pressure you're talking about is during exercise. So I guess my first question might be, how would you know if you have a dysfunction in pressure? And follow up, when do you need it?
So how do you know you have a dysfunction? That's very individual, because something that really might not bother you might greatly bother somebody else. A lot of times I'll say, does it really affect your daily life? You know, I would also say though that it's not normal to leak urine if you're just going for a walk down the block or every time you laugh. So even if it might not bother you, that would be a dysfunction, because that, you know, that is something that you should be able to control. So what was your second question? When might we you need to use this?
Yes.
Yeah. So it could really be used any time. What it does is it augments the contractions and through the rest of your body. So it's really not specifically just for exercise or just for a strenuous activity. You know, generally, if you're just walking down the block, maybe holding a heavy purse or something, you're not going to need it then. But it can be beneficial when you're doing really any functional activity that you have either had problems with in the past or we're trying to strengthen. It just helps augment the strengthening through the rest of your system. Does that make sense?
And those, you know, Kegel exercises, I remember hearing about those, and it's not something that I've kept up with. But can those be started even as old as we get, as older? We can start at any time, right? And that can really help.
You can start strengthening anytime of anything, yes. Kegels aren't always the prescribed exercise, so it's, yeah. So,
Floor is what you're strengthening, right?
the pelvic floor is what you're strengthening, with the Kegel, yes. So, we don't always recommend Kegels to everybody right away. Sometimes we actually recommend to pull back on that, because you need to relax before we can start strengthening. But our bodies are primed for improvement at any age. We don't, just because you're over a certain age, doesn't mean we won't see you. We can always improve. Yeah, absolutely.
I just have a question.
Yeah.
So when you're explaining to people to do the closed glottis, what is the breath doing? Are they exhaling?
Yeah.
Are they holding their breath?
So good point, not holding their breath. So you're still breathing, you're just breathing through your nose. Yeah. Yeah, so we don't ever want to hold our breath while we're doing a functional activity. Sometimes powerlifters do it. It's a certain maneuver that they specifically train for that. I don't definitely recommend it, especially in women. We have a lot more proclivity for, we don't want to put a lot of pressure down through our pelvic floor when we do activity. So no, we don't ever recommend holding our breath when we do any activity. Yep.
So I'm pretty familiar with all the TMJ and Glottal Closure and all that stuff because I'm a singer. So,
okay.
But I'm really just fascinated by the connection between the two because I teach private waist lessons and it's really interesting just the posture and the pelvic floor and everything,
yes.
The connection. So
yeah.
My question is it one affects the other or do they both affect each other? Like for example, if you have if you're have pelvic floor dysfunction, is that what then eventually creates the TMJ and the lack of glottal closure, or is it? Do we know?
I would say right now, from what we know, the better answer is that usually pelvic floor dysfunction can come to light more from a jaw dysfunction, from a TMJ dysfunction. Can it happen in reverse? Your pressure down here is really more dependent on being able to regulate pressure up here.
Okay. Sure.
So even if you have the inability to really efficiently close that glottis up here, can you still strengthen your core and pelvic floor? Yes. It just might not be as efficient as we want it. And again, it's really individual for everybody. So, but this has just been a really interesting piece of the puzzle that's kind of come to light in how really everything really does work together.
That's really interesting. I didn't, I never knew there was a connection.
Mm-hmm.
Yeah, thank you.
Anyone else? Okay, thank you.
Hey, hi, my name is Erin Bafunno. I'm a physical therapist here. I don't know if anybody gave an intro. I've been here for 8 years. And I've done this talk in the community a handful of times. I've just shortened it a touch for here. So basically, this is foam rolling 101. So I always give a caveat on no matter what you've heard about foam rolling, every person will tell you something different. So you've seen it on YouTube, if you've seen it on the internet, everybody will have something different to say. So just because I say something, that does not mean that whoever you heard something from previously is 100% wrong. We just have differing opinions. And just like Penelope was talking about with the Pelvic Floor TMJ Association, we have some research behind foam rolling, but not a ton. So it's not something where just because one person says it works in one research study, it does not mean it works exactly the same in something else. So this is, I've touched on like one research study in the shortened talk, but again, just because you've heard something before and I say it's not a good thing does not mean it's a bad thing for you. So to get started, what exactly is foam rolling? So we have these wonderful foam rollers here. If you've not seen them before, that's what they are. We utilize them to basically perform the idea of self-myofascial release. So you can term it myofascial release or soft tissue mobilization, which basically just means trying to muscularly release the body, the muscles in our body on our own. I love this for a lot of patients because the intensity of the release is completely dependent on what you can tolerate, but we will talk about what that kind of means in a little bit. And it can be uncomfortable, but it should never be painful. So I always say, like John Mellencamp's song, "It should hurt so good." Like nothing you really do should be 100% painful. Or if you are familiar with the pain scale, like 0 to 10, so 0 is no pain at all and 10 is emergency room pain, just like with your stretching or exercising, nothing should be above a 5 out of 10. So that 0 to 3 out of 10 pain is you're like, oh, okay, I feel it, but I can live through it and it's not always in the front of my mind and I can forget about it. As soon as you start to get to like that 4 to 6 or above, that's more that constant toothache, almost going to be a root canal pain that I just can't get out of my mind and I want to take something because it's uncomfortable. So again, it should always be in that 3 out of 10 range or below, so it's comfortable. So then again, what is the idea of, but it says, what is the idea of myofascial release? So with that, we utilize a low load but long duration technique. With true myofascial release, when you have it done in the clinic by a therapist that does treat it, usually positions and holds are done for up to 5 minutes. So I don't ever actually ask a patient to foam roll for 5 minutes, because just talking about the food nutrition piece, like how do you do all of that in a day? It's pretty hard to do how many body parts for 5 minutes at a time. That's asking a lot. And we want you to follow through, and we want you to feel good about following through and being independent on something. So we'll talk about, again, what that means in a little bit. And I do like, because you can perform this also manually or with a device or with a foam roller. So I love this picture in the next one because it kind of explains fascia to someone that's never seen it in a human body. As PTs, we are lucky enough to go through cadaver training, so we actually get to see this in a human, and it really opens your eyes as to how significant it runs through the system, which a lot of patients, I feel like it's a buzzword, everybody talks about fascia, but when you don't truly understand what it is, it's kind of hard to put a finger on what it actually is. So it's all of this like spider web type material that's running all along the bone. So this is bone, muscle tissue, and it truly wraps around every single thing in our body. So arteries, veins, nerves, bones, ligaments, everything in it. So it's truly attached to every single thing in our body. So it's truly extensive. So when we talk about having myofascial release done, if you think about one piece in your body being tight, it can be really beneficial to basically treat that area. Yes.
By that image, it looks like it's deep down next to the bone. I thought it was right under the bone.
So there is some underneath the skin, but then it continues to wrap all the way down through to the bony layer. So when you do have a surgery done, if anybody of you have been lucky or unlucky enough to have a surgery, that when they go through and do any of the surgeries and have to get down through muscle, they have to do so many layers of stitching on the way back up. So whether you have staples on the outside or you have any sort of incision work, you're going to have, like, they will sew you up on the inside as well. So they have to address all of these other layers that they do address. So it's not just underneath the skin. That is usually where we try to address it, because it has a link to all the layers below. So this is where then it's all connected. I also like this picture. So if you look at or think of the idea of someone wearing a cable knit sweater, or you think of this person in this little bodysuit, is if you have a tightness in one side of your body, you can see the tension that's created throughout the whole body. And because that fascia is truly linked through multiple layers, it can pull on so many different parts of the body that, yes, because you have knee pain, that could be because you have tightness in your back. A lot of those things do correlate together. So what are the benefits of foam rolling? So the idea, some of the biggest idea that most people talk about is the releasing of the myofascial tightness. One of the things we treat a lot in physical therapy, especially here with during needling as well, is the reducing of trigger point tenderness. So those are those areas in your body where you roll over something and you feel a little ball, or maybe a little tight spot, and you feel your muscle kind of twitch underneath your finger. That would be the idea of trigger points. Trigger points are muscles that just kind of get stuck on top of each other, and then they don't move as well, and they get really irritated, to get inflamed, and they can sometimes be more tender than other parts of the muscle. It also can relax the nervous system, which is the main reason I will talk about why foam rolling is actually beneficial. It increases blood flow, which is just like any manual therapy technique we utilize in PT, as well as the benefit of exercise. If you can increase blood flow in the body or to various parts of your body, blood flow is like our water that like humans need to just survive. Is if you can increase blood flow, you're increasing oxygen and good nutrients to the parts of your body that need the healing. Again, it promotes healing. It can increase flexibility. Any sort of use of foam rolling is beneficial for all activities levels. So meaning for someone who just walks down the street to go pick up their mail to the triathlete. So it's great for any person in between. And again, it's relatively inexpensive. You just have to buy said foam roller. So this is the one research study that I really love to touch on, because it talks about kind of why they think foam rolling works. So it's been around for a while, and there's so many people that say it's an absolute must. You should do it all the time. A lot of people say, oh, you have to do it before you work out. Some people say you have to do it after you work out. So again, that's where everybody kind of have varied views, because there have been a lot of studies that have shown positives of everything, of being before, of being after. And again, unfortunately, the research kind of keeps changing, so there's nothing 100% significant that we've come up with as to what we would recommend. But this study was really interesting because they had patients utilize foam rollers on only one side of their body, and they looked at their dorsiflexion, which is pulling your toes up toward your nose. So they measured the dorsiflexion range of motion on both sides, and then they had them only foam roll the back of their calf on one side. And it was interesting because every single person had a significant increase in dorsiflexion range of motion on both sides. So they had more on the side they foam rolled than they did on the side they didn't, but both sides had actually a significant increase. So the reason behind why this is important, which I talked about in the benefits piece, is that it relaxes your nervous system. So they talk about when we utilize foam rolling or other items you can use instead of a foam roller, you are actually inducing some level of discomfort to the body that helps us kind of regulate pain. So it gives your body an idea of what a normal low level pain or discomfort should feel like, which if you're in chronic pain or if you feel pain a lot of the time, it helps your body lower that idea and understand what normal should feel like. And when that happens, it helps our nervous system calm down. Another idea behind that too is our brain can only understand so many signals of pain at one time. So when I usually explain this to a patient, it's like if you hit your elbow and you hit your funny bone, which you're hitting a nerve, and you get like those zingers down your hand, why do we rub our elbow? It does nothing to the nerve. It actually just gives your body something else to focus on, which then helps you release the pain and not think about it as much. So unfortunately, that's probably a little bit of why foam rolling works, but it's basically tricking your nervous system. And that's essentially what we try to do with a lot of physical therapy, a lot of activity, is how can we actually how can we help our body figure out what to do to fix itself? So it's a very interesting concept. And interestingly enough, actually in that study, so things to talk about in terms of like how often do you do it and when you would do it. So most of the research I feel like has come across saying it's actually more beneficial before activity. So actually utilizing it as a warm up and not after. I feel like I used to tell patients to do it after all the time, and I've actually changed based off of some of the research I've seen more significant or more recently just because of that. Has it made a change? I don't know. But again, this is where every person's different. If someone's done it that way for years and it's worked for them, that's great. So if you do it that way, you can do it after your activity. But if you're not a big person that likes to stretch, we're not a big advocate of having someone hold really long stretches before you go exercise or go for a walk. Or if you have a foam roller and you can use it regularly, that's a great option to roll on it just to warm your muscles up first before you actually go do the activity. So this slide is actually precautions. So for the biggest thing I usually tell people is just be careful if you're on blood thinners. That does not mean you have to avoid it. It's just be more aware if you see if you're bruising or not. So if you are noticing some bruising, then this is not something that I would do on a daily basis. This would be maybe once or twice a week. And even if you're still bruising, then it might not be an option for you. And then you don't want to spend too much time on one area. So a lot of the research studies show between 30 seconds to 2 minutes is about all you need to do. So any more than 2 minutes is almost overkill, but they found like the max benefit actually occurs and stops at 2 minutes. If people continued after that, they didn't see much more of an improvement. And then again, excessive rolling can lead to bruising, swelling, or increased pain. So if I have a patient that really has a benefit from rolling, but then they start upping it because they're feeling a little more sore for a different reason, and they're doing it every day and come in and say, it just feels like I have a bruise, like someone hit me, but I can't see it. That means you're doing it a little too aggressively, and either you should back off the intensity or reduce the total time you're doing it. Do not roll over bony areas. So when I say hip bone, I mean that one when you lay on your side in bed and sometimes it gets sore on people. So that's more the hip bone I'm referring to. I don't want you to roll over your kneecap, or you could, I guess, roll your elbow because you're not putting a ton of weight on it. But generally those bony areas, since they're really superficial, they can get really irritated because there's some tissue and what we call bursa usually sit in that area, and they can get inflamed pretty easily. So this one is always controversial when I teach this class, is do not roll over the low back. So I'm referring to if you were to lay physically on your back over a foam roller in that true like lumbar position. Generally, because of the instability that a lot of people tend to get in their low back, it's just not a super wise thing to try and lay and force your back to go in more of that extended position. Again, if it's something you've done, it feels okay, then don't change it. But that's not something I generally recommend to people. If you feel like you need to roll your back, you can roll on your side if it does not hurt your rib cage at all. But it's not when I generally recommend to roll on your low back. Now, rolling on your upper back is a different story, because so much of what we do in a day when we're talking about posture is that rounded forward position. So anything we can do to just gently help extend our chest backwards or increase our thoracic mobility into what we call extension, is pulling back, that actually can be super beneficial. So the two parts of the back are different. The upper back is okay. The lower back is a little dicey. And then my last line says, if it hurts, don't do it. So again, it should be a hurt so good sensation where you feel good after you do it. It feels good while you do it. No part of it should be painful whatsoever. So then this is where I like to use the different tools for self-release, because foam rollers are great, but you have to be able to get on the floor. And a lot of people can get on the floor, but then you have to be able to get off of the floor. So again, you can get on the floor, but you have to be able to get off. So if that's something that you have difficulty with, or if it's not something you feel very confident with, that's not something that I would highly recommend. So that's where we have other things. So just because they use the foam rollers in those studies does not mean you are limited to a foam roller. So you can use a stick, and if you don't want to buy, this is literally called the stick. I call it the marshmallow stick, but it's just called the stick. You can buy various versions and multiple different forms of retailers, but a rolling pin from home works just fine. So if you don't have a stick, you can just take your rolling pin. If it's an older wooden one, just don't do it on bare skin. Like either put a towel on your leg or make sure you have some sort of clothing on it before you attempt to roll it. You can use a golf ball. A lot of people have those laying around, or a lacrosse ball. A tennis ball also works just fine. Even if you have an old stress ball laying around, yeah, they're super soft and they might collapse a lot, but that could be a good starting point. Is if you feel like you are pretty tender to any of those other ball options, starting with something like that is a good way to just start introducing some, we call it desensitization, is again, just kind of calm your nervous system down and give your body an idea of tenderness, but not pain, to again, help your body release some of that musculature. One other thing about foam rollers is if you see the different colors, they mean different things. So from the true PT brands that we have here, you usually will see a white, a gray, and then I didn't bring up black because I need to. So the white is our lightest and least dense option. So if it's something you were interested in starting and you've always seen the black ones and you've read the black one every time and you're like, this is miserable, I hate it, and I never want to do this again, it could be because the black just might be too dense. The gray is the middle density, like Goldilocks and the Three Bears, and black is our most dense option. So for people that do have maybe more chronic pain, or you have fibromyalgia, or you have something that just a higher pain level consistently, that's where I would generally recommend starting with our white foam roller versus a gray and a black. They're made much better than they used to be made. They're made out of different material now, so they used to fall apart and crumble to pieces, but they don't do that anymore. So they've been made out of much better material over the years. So now I will go through, I basically just picked the top 5 foam rolling exercises that are some of the easiest to do and people get a great benefit out of. So this is our pec stretch, kind of our basic idea. When you lay on the foam roller, you have to have your whole spine along it. So the base of your head all the way along your spine, and then your butt should be on it as well. I had some really tall patients, and I've not had one that's too tall for regular foam roller yet. So everybody, your back should be able to fit from head to tailbone on the foam roller. From here, if you keep your knees bent up, that helps give you a really stable base. A lot of times patients will come into me afterwards and say, I feel like I'm falling off. That's usually because patients are laying there with their feet together. So separate your feet nice hips width apart, because that will just help you feel a little bit more stable. And then from here, you just rest your arms out in a T with your palms up. So if you go palms down, if you have a history of shoulder issues, that might feel a little uncomfortable. And when we're talking about trying to release the pec, we want to go palms up because that puts a little bit of extra stretch on the pec tissue. If that feels like that's too much, or you start to feel like a numbness or tingling sensation, sometimes that can kind of come up into your pinkies or maybe into your thumb, just lower your arms down. So think of this as 90 degrees and this is 0, as you can start at 0 and think of like a snow angel or a jumping jack and work your way up through that until you find a position where you have a good stretch, but it's not painful or you don't have numbness and tingling. So this is a great one for most people. If you work at a desk, if you ever are in front of a computer or a phone or reading during a day, this is a great option because again, when we sit and we do those prolonged positions, or driving in a car, it doesn't have to be related to a computer. Any of those prolonged seated positions, we're in that rounded position. You can see the pec muscle goes from our sternum and comes all the way out to our humerus, which is just our arm bone here. And when that gets tight, it really forces you to round forward. Think of how many hours a day we're upright doing something forward. That is so many hours. So 2 minutes a day is not too much to ask to semi-reverse what you do for however many hours a day you're doing those related activities. If that was too easy, then a great progression is then to move into, like a lot of people call it, like the football, like you kick through football poles or whatever. I don't know why I can't think of it right now, but so goal posts, thank you. All right, so you put your arms in goal posts. And this one, if you are particularly tight, I do find patients get a lot of numbness and tingling with this one. So just be mindful with this one that this is not holding for 2 minutes straight for a lot of people. You do have to work up to it to really let your chest relax a little bit. The goal, believe it or not, is to actually get your forearms completely down to the ground. Now, that does not mean you lay there and you force them back. You let gravity do the work for you. So no part, again, of any of this should be forced. Now, these two are not like your typical foam rolling because we are not rolling, but this is my favorite exercise to do for just about anybody. If you can't get on the floor, you can actually like put this up against a wall and then try to pull your hands back to the wall. Again, gravity's not there to help you, but that's a great way to kind of help stabilize your spine if you felt like you wanted to add a little extra stretch to that and use your foam roller. So thoracic mobility. So this was the piece I was talking about where I say it's okay to roll the upper side of your back, but not okay to roll the lower portion of your back. I will demonstrate this one because this one's a little tricky. My only caveat is if you have a history of compression fractures or significant osteoporosis, this is not one I would recommend because we are a little closer to the spine on this one. So in this position, she is laying down with her knees bent, almost like she's doing a bridge. So she's actually lifting her butt up off of the floor and pushing some pressure onto that middle back. So I say to start from the bottom of the neck. So right where you start to feel that big spinous process or that big spiky bone stick out at the base of your neck, you want to start just below there, and you're going to go all the way down to the bottom of your rib cage. So that's like your safe space. If you think of your rib cage, that is like your armadillo. It's your big back, your big shell that basically protects all your organs. We're not trying to roll over our kidneys or anything like that. So you want to keep it over the rib cage. And then to intensify the stretch, you can bend backwards, which will increase the thoracic acceptance. So I will show this one just because the picture's a little goofy and it helps. All right, so we'll sit down and lay back almost like at bra strap height to start. Hands behind your head, and then I will tell patients to tuck their elbows in because it helps get your shoulder blades out of the way. You're then going to dig your heels into the floor to lift your butt up, and then you're just going to rock back and forth. If you feel like a spot kind of takes your breath away for a moment, you actually can pause on that, drop your butt down, and then gently let your head rest back. Still trying to keep my nose pointed towards the ceiling. I'm not trying to let my whole head drop back. I'm trying to keep my head stable and just really increase the stretch through that area. So with this one, it's not out of the ordinary for people to feel some popping and cracking as you do that one. So it does not mean you're hurting yourself, you're not breaking anything. Because our body is sitting in those flexed postures all day, it's actually opening the joints quite a bit so that when we extend backward, it's almost pushing them together where they should be. So our body's just releasing air pockets. So that's very normal. They shouldn't be painful, and if it is, please stop. But they should feel kind of good afterwards. So then here, this is another very common one, is working on your glutes or piriformis. So again, that can be commonly linked to any sort of pelvic floor dysfunction, low back issues, potentially knee issues as well if you have a lot of hip tightness. So you can control how much pressure you put through the foam roller by how many points of contact you have on the floor. So if you have you should have at least 3, she's only showing 2, but points of contact mean how many pieces of your body are actually touching the floor. So 3 can be the most beneficial because then you can actually offload how much pressure you put into the muscle. If you only have a hand and a foot, she's trying to offload her weight by pushing it to the ceiling. I'll show it in a second, to control how much pressure she's putting into that left glute there. She's showing the most advanced position, crossing her leg over because that puts the most stretch on the glute musculature, the deep piriformis muscles. So you're getting a greater stretch in that position. I should just stay over here. Okay. So this one you would start by, you can start by sitting on it and sit back on your hands, or if you have the shoulder mobility to do so, you can prop yourself up. And then first level would be to just rock your knees to one side. So this is my left side, this is my right, and now I have all the pressure on my right side. And I'm just using my legs to rock back and forth. So here I have what's called, like, again, 4 points of contact. 1, 2, 3, 4. So if that's too much pressure, I can push my legs up, or I can push my heels into the ground, almost like I'm doing a bridge again, and I can take a lot of the pressure off. Because again, we want it to be pressure, but not uncomfortable. And then, again, if that's too much, you can reduce how much sway you have in your knees to take pressure off the muscle. I then can cross one leg over, which adds more stretch, just like a Piriformis stretch or a glute stretch, and then sway to the side. And then, again, perform that same rocking back and forth motion. And again, for most of these, again, that 30 seconds to 2 minutes is about the sweet spot. I wouldn't do too much more than that, because then you're kind of just wasting your time. And then the last, I think it's my last one, is working on your quads and hip flexors. So again, your quads are those muscles that right in the front of your thighs. Hip flexors are, again, another big buzzword with everybody working at home and sitting a lot. So when you're sitting, your hip flexors are the muscles that do this. So when you sit like this all the time, they get really tight. And when you try to stand up, if they're really tight, they're going to be causing a lot of shearing forces through your back and might not allow you to fully stand up straight. Another piece I will talk about in conjunction with this, because it's always a hot topic, is rolling your IT band. So in this, again, hot topic because I say something that not a lot of people agree with. So I'm not a huge fan of actually rolling your IT band itself, mostly because every single person says it's one of the most painful things they've ever done, and they about cry when they do it, and they're always really bruised afterwards. So your IT band is a really thick band of fascia, very, very thick, that goes from that hip bone on the side and it comes all the way down to your knee. Very common irritation, can come with like distance runners, people changing their running. You can get some irritation even after hip replacements or knee replacements. Some of that can crop up. We see it a lot mostly because of hip tightness and hip weakness. So when we talk about the IT band, it actually is so much of the tension gets built up because of the tightness in your hip muscles themselves. So there's 2 muscles in the side of our hip that actually attach into it, and a lot of the tension that creates the tightness in the IT band actually starts there. So I'd rather have patients start rolling in their glute muscles first, and if that doesn't do anything, then we can try slowly working on a low level intensity rolling the IT band. I think I've only had one person I ate my words on and I told them to roll their IT band because they had one that just stuck out of their leg. It was so tight, I actually could have played it like a guitar string because it was the tightest thing I'd ever seen, and they had a lot of swelling present. So for them it was beneficial, but for most people, it's so uncomfortable. That's the one where that goes against all my boxes. I said, if it's really that painful, no matter what position you do, it's just not worth it. And I will show why. But your quads actually partially attach into it. So you can roll the front of your thigh, and you can roll the outside of your glute, and you can actually make your IT band feel a lot better by rolling those 2 spots. And if you think about just our anatomy itself and just your legs, we have a lot of meat here, and we have a lot of meat here, and a lot here. But we don't have a lot here. So if you were to just push down, you don't have to push very far before you feel like you touch bone. So when people roll the IT band, you roll on your side, and all of your weight is just rolling on it. So if you imagine, if we don't have a lot of cushion there, that's not going to feel great. But if I roll half forward, and I'm rolling just in front of that side seam of your pants, I'm getting more of the outside of my quad, but that muscle also partially attaches to the IT band. So if you can take all the tension around it away, that can actually help reduce the tension that you would feel through the IT band, whether you're having pain at your knee or you're having pain up at the outside of your hip. I guess that's it. So any questions?
If you don't want to use this one, that's not time to fade, right?
So there's a bunch of different names for it. Yeah. So if you look up like rolling stick or myofascial stick or anything, any of those are good options. Again, a regular rolling pin at home works well. If you have a dowel rod that you're not using, or an old Swiffer stick, like not a Swiffer wet jet, but like an old Swiffer stick, like those work well because you can just roll it up and down your leg. And I'm always a big fan of find what you have at home first before you buy something. Like, again, there's fads all of the time, and this I think is kind of one of them. But again, if you have a ball at home, or if you have a stick or a dowel rod or something, you can always use that to just roll over it. Like I can just take a ball, and if I was having a tibia pain, but I didn't want to buy something, I could just sit and take a ball and just roll it here. Or I instruct a lot of people to do this for shoulder pain. I'll have them take it and I'll put it in a pillowcase, take the pillowcase and throw it over your shoulder and lean against a wall. So you're not dropping the ball 400 times. It works the same for your glutes. If you couldn't get on the floor and you wanted to roll your glutes, you throw it in a pillowcase, hold it in the pillowcase, put it on your butt, sit against the wall, and then you can roll side to side. So again, you're not dropping the ball 24/7. Again, if you can't get to the floor safely or you can't stand up, the pillowcase is a nice way for you to do it safely. But if your back's hurting, you don't want to be bending down every time you drop the ball because you leaned away from the wall for a second. So again, I'm a huge advocate of use what you have at home first before you buy something, because again, if you buy it, you might use it for a little while and then it goes in the basement or somewhere else. Yep.
Erin, did you say your point of view is before or after exercise?
Before.
Before.
And again, this is one of those things, every person's body is so different, so try both. So for a week, try it one way. For the next week, try it after and see how you feel after each one and see which one feels best. Yep.
What about pool noodles? Are those too small?
No, so pool noodles work well as long as, and I think that it's not too firm. And you could also use it on your bed to utilize it. So if you're rolling, you can also roll on your bed. I didn't mention that, but I just thought of that one. But pool noodles are great as long as they're not falling apart. So again, sometimes those just get a little dried out and then they fall apart, and then, but other than that, they're fine. Oh yeah.
What if you have arthritis?
So generally when any person has arthritic pain, we tend to see a lot of associated muscles like near that joint. So as long as it's not painful to your joint as you do it, it can be helpful. Because you're putting some pressure through it, it can actually, again, give your body an idea of what pain is and what pain isn't. So it can help your body relax those muscles near the joint if you are rolling that specific area. So again, the hardest part with rolling if you have arthritis is what body part you're trying to roll, and then finding a way you can do it that doesn't irritate the joint while you do it. So for knees, it's hard for most people to get on the floor and get off of the floor. So generally sitting in a chair and using a stick or a rolling pin to, again, if your knee was bothering you, you could just sit in a chair, use your stick, and roll all parts of your thigh, just nice and easy like that. And then you can pull it underneath your leg and then get the back of your hamstrings. So if you can just, again, give yourself, if you're just telling your body to relax the nervous system, and that should help you feel a little looser afterwards. So then when you walk around, it might be a little easier to walk or do the stairs. The effects might not last long. So they did notice with the range of motion improvements in that one study, some people it was 30 minutes and not many people it was longer than 2 hours. But if you can walk better for 30 minutes, you are using your muscles better for 30 minutes. So your body's getting a better experience of how to load your knee joint correctly and not to do all those compensatory patterns we generally do when we are in pain. So if you can kind of break some of those pain cycles, then our body does better at trying to, I hate to say fix itself, but our bodies are amazing things and they can do a lot to fix themselves if we give it the right tools.